Hi, my name is Haley Kennedy, and I will be demonstrating wound irrigation and dressing change today. The first thing I would do is review the patient's health record for any prescribed wound care or anything like that. I would then perform hand hygiene and put on any PPE if indicated. Next, I would identify the patient. I would assess the patient for any pain meds or anything like that and make sure that I give it enough time to kick in before we even start the procedure. Next, I would close the curtain around the bed and the door to give the patient as much privacy as possible. Next, I would place a waste receptacle right by my table. I know it's supposed to be at waist level, but this is the best I got, so I would place a waste receptacle right within reach. And then I would make sure that I gather all my supplies. So I have everything over here that I will be needing. Okay, and then next I would adjust the head of the bed to a comfortable position for the patient, usually at elbow height. And then I would assist the patient in a comfortable position, make sure that I have easy access to the wound area, and I would make sure that they are kind of like I would prop them up so that when I irrigate, the fluid will run from the cleanest or from the clean end of the wound towards the dirtiest. So next, moving on to removing a soiled dressing. I'm just going to pretend like there's one on right now, but there's really not. Before I would do so, I would check the position of drains, tubes, or anything like that before even removing the dressing. Next, I would put on clean disposable gloves, and I would loosen the tape on all outer sides of the wound, and using the push-pull method, so pushing the skin back and pulling the tape back, I would slowly remove the old dressing. And then I would carefully remove the old dressing, and if any of the dressing sticks to the patient's skin or is causing them any irritation or pain, I would use an adhesive remover while removing it. So after removing the soiled dressing, I would note the presence, amount, type, color, and odor of any drainage in the dressing, and then I would toss it in the waste receptacle, or the old bandage in the waste receptacle. Next, I would assess the wound itself for the appearance, stage, presence of eschar, granulation tissue, epithelialization, tunneling, undermining, necrosis, sinus tract, and drainage. So I would assess the appearance of the outer tissue as well, and also measure the wound. So to measure the wound, I would take measuring tape and I would measure the length, so about 5.5 centimeters, height of it 2 centimeters, and then to do the depth, I would open up one of these, and then I would put the swab in at its steepest point, and then where I see the mark of fluid, it's about like 3.5 centimeters deep. So after measuring the wound, I have removed my gloves, placed them in the waste receptacle, and performed hand hygiene. The next thing that I'm going to do is set up a sterile field, and then get my wound cleaning and irrigation supplies together. So the first thing I'm going to do is take my drape. I'm going to open it away from me. Then once again, sorry, my table is way lower than waist level, but it's the best I can do. So next, only grabbing the corner of the drape. Okay. All right. So after I've set up my sterile field, I will set up my gauze. Get it open. Away from me. Okay, and then I would then set this. I'm going to be using this for my my irrigation solution. So I would set this on a the non-sterile field. So the table isn't big enough, so I'm just gonna have to place it. So that would be technically off to the side, not on my sterile field. Okay, I would discard. Next is an abdominal pad. Okay, discard that as well. My irrigation tray. Then I will be using this actually later. I'm going to be placing it under the wound to collect the irrigation fluid. And then next, I will be pouring some warm sterile solution into the basin that I said earlier. Okay. Then I would set this off to the side in case I would need it for later. Okay. Then also I would set up my tape so that makes it easier for me later on in the procedure. I'm going to need 4 pieces for all 4 sides. That should honestly be good because the wound isn't that big. And then one last piece that I will write my name on, or I would initial it, put the date and stuff like that. After I have all my supplies set up, I will be putting on sterile gloves. So I'm going to put them on this part of the bed. So okay. All right. Being sure only to touch the non-sterile part cuff of the glove. I would make sure that I leave the cuff on till the end of the procedure. Next, only making sure I touch sterile to sterile, making sure my hands are at my waist level. Once again, only touching sterile to sterile. Okay, and then I can go in and release this cuff as well. Okay, I would have thrown that away before I even finished. Or actually, I could just grab it by the center and throw it away. Okay. So next, I will be getting my field more organized together. I want to make sure that my hands are kept at waist level. Technically, I want to be bending down or really bending over my field. I would make sure that I wouldn't contaminate it, but because of what I have today, this is gonna have to work. So next I would just get my supplies basically all set up. Okay. This is my abdominal pad. Oh, I would set this up as well underneath the wound. Okay. So this is going to be my contaminated hand, and my sterile hand is my dominant hand because I've touched things with this hand. So my abdominal pad. And I'm also going to take a few gauze pads. I'm going to take 2 of them. I'll put them in my sterile solution. Grab another one. Kind of wad them up. Okay, perfect. So now that everything is set up, I will be filling up my syringe. With some of the fluid. Okay. Then I would transfer this. Actually, no, I would keep this. Okay, using my non-dominant hand, I'm sorry, I'm just blanking. With the basin pressed up against the wound area, I will then irrigate the wound. This is hard. By going from the dirtiest area, so the top, to the bottom, making sure to fully irrigate. Then I would dispose of my syringe in here and place that off to the side. Okay. So after that, it was hard to see, but when I was irrigating, I would just direct the stream of fluid right into the wound, keeping the tip of the syringe at least 1 inch above the upper edge of the wound, and I would flush all wound area. Okay, so next you want to make sure when you're irrigating that you watch for the solution to flow smoothly and evenly, and when it flows clear, you know that irrigation is done. So once the wound is cleaned, you want to dry the surrounding skin using a gauze. So using my sterile hand, picking up sterile, moving it to non-sterile, and you want to start drying. Let's start with the upper part of the wound. Okay, and I would discard. Okay, using another piece, the lower part of the wound. Discard. And then using one more, the inner part. Make sure it's nice and dry. Okay, discard. And then at this point, after you have irrigated the wound and dried it, you would get a wound culture if needed. So this is the time that you would do that. Since we do not need one for today, we're going to move on. So next, You would, if there was a drain also on the wound, you would make sure to clean that area as well. Sorry, I forgot that step. And then next, you would apply a skin protectant or barrier to the healthy skin around the wound where the dressing or tape was in contact before. So you would do that at this point. And then you would apply any topical medications like gels or anything as prescribed. Next, we're going to pack the wound. So next, with my sterile hand, I'm going to take one of the swabs, put it in my non-sterile. Then with my sterile hand again, I'm going to take the gauze that I put in the solution earlier, kind of wring it out, and then like unwad it. Okay. And then using my sterile hand, making sure to kind of only keep in contact with the gauze, I'm going to start packing my wound. So the Q-tip as well. And with this wound, we only removed one gauze. So I'm going, like hypothetically, we removed one gauze. So I'm only going to pack it with the one gauze as well. Okay, so I want to make sure that's all packed in all areas, making sure that if there's any deep parts that you're packing it properly. That looks pretty good. All right, and then I would dispose that as well. Okay, so next we're going to put an abdominal pad. Or first, actually, taking my sterile hand again, I'm sorry. You would take one piece of gauze, place that over the wound. I'm actually going to fold this because my wound is very small. So this is kind of hard to do. And I just realized the ABD pad is going to be humongous, but that is okay. So next, I'm going to take the ABD pad, sterile hand, non-sterile. Oh yeah. All right, we're gonna fold this up as well. I'm sorry, my wound is very small. Okay, that's gonna have to work. So the ABD pad gets placed over the gauze in the wound. And you want to make sure the blue, there would usually be a blue line on the ABD pad that is facing that side towards you. So it's facing away from the patient. Okay, so next we are going to place our tape. So, this is not going to want to come off. Oh, okay. So next we would place the tape top. Technically, I would be removing this tape from a bedside table that I would have prepped beforehand. Okay, the sides. Bottom, making sure it's secure. And the side once again. Okay, and then I would use one more piece of tape that would have my initials, date, time, so that people know who dressed the wound. Okay, and at this point then I would discard my gloves. I had removed my sterile gloves, and then like I was saying before, after you have finished securing the dressing, you would label it with the date and time. And removing all remaining equipment, I would place the patient in a comfortable position. And then I would remove any PPE if possible and perform hand hygiene. And then I would check all wounds dressings at least every shift. More frequent checks would be needed if the dressings became more saturated faster. But yep, that is my wound dressing. Thank you for watching.